My name is Sarah, and I'm here with Mandy, Irene, and Megan. This is an instructional video for parents on the IEP process. It can be difficult to understand how and why students may be referred, and when they, if they are referred, how the process works. This video will hopefully give parents a clear understanding of the process. All students are being assessed at some level within the classroom. Most students need only the guidance of a professional educator or highly qualified teacher. However, some students have unique needs that are atypical for kids their age, and those needs may not be within the expertise of the general education teacher. It's during this time that the teacher, parent, administrator, or counselor recognizes consistent need or problem exhibited by the student. The discrepancy may be academic, social, emotional, behavioral, or a physical ability that would signal a need for additional academic or behavioral supports. If a student is recognized as needing additional supports, it's important to call a meeting with parents or guardians. The teacher should provide examples of the student's work or notes regarding students' needs. Some things that should be explored during the meeting are, is it a new or recurring problem? Is it a constant issue, or is the issue appropriate for children this age? It is possible that the problems being exhibited may be solved with a cooperative plan between teachers and parents. If not, the next step is known as pre-referral. This process is more formal than providing simple and temporary accommodations for students. Pre-referral intervention is to identify, develop, and implement alternative education strategies. This is for students who have been recognized as having problems or discrepancies before having an official referral to special education. Because of changes made to the Individuals with Disabilities Education Act 2004, many states and school districts have started using a more systematic pre-referral process called Response to Intervention, or RTI. RTI is a model designed to address the needs of all children through the continuum of services, which include highly qualified instruction and tiered evidence-based intervention based on individual needs, frequent monitoring of progress, and application of child response data to important educational decisions. RTI provides 3 levels of interventions. First tier focuses on utilizing high-quality general education instruction in the core curriculum with all students. RTI theorizes that roughly 80% of students will respond positively to core curriculum and behavior systems. Tier 2 provides targeted group instruction to improve performance. RTI theorizes that the second level will improve performances for about 15% of all students. If Tier 2 does not work, students are moved to Tier 3 with intensive individualized interventions. Both pre-referral and RTI are intended to provide interventions that will help students achieve success without special education.
Once it has been determined that the student may benefit from special education services, the referral to be evaluated can begin. The referral may be by a parent, it could be by a teacher or another school professional. Parents must give their consent, however, to start the evaluation process. So if a teacher decides that they want evaluation, the parent must provide consent. So the evaluation is the process to which your child is assessed to determine if they are eligible or qualify for special education services. The assessment will likely be completed by the district school psychologist and will measure things such as cognitive, academic, language skills, social, emotional, along with developmental and medical issues. Beyond this assessment, the teacher may continue to collect some data and information about your child, and the student records are likely to be reviewed. This evaluation is called the ETR, which stands for Evaluation Team Report. The ETR also helps identify what modifications and services that your child may need.
The next step, step 4, is eligibility. This is where we determine whether the student qualifies for individualized education. And it also involves identifying whether the student has a disability and if the disability adversely affects the student's academic performance enough to qualify for special education services. And to determine if the student qualifies for individualized education, there are several assessments or batteries of tests that are given, and those tests are generally evaluated by the school psychologist, as Mandy had previously mentioned. And to determine if the student has a disability, the student must meet one of the definitions of the disability as recognized by the federal law that governs this process, called the Individuals with Disabilities Education Act. And some of the examples of the disabilities that qualify a student for special education services include such things as speech language impairment, specific learning disability, attention deficit hyperactivity disorder, emotional or behavioral disorder, intellectual disabilities or mental retardation, physical or health disability, deaf or hard of hearing, low vision or blindness, autism spectrum disorder, or traumatic brain injury, just for examples. And if they do meet one of those definitions, and the team also determines that the disability has an adverse effect on the student's academic performance, then they will qualify for special education services. And if so, then their education is the shared responsibility of the general education teacher, the special education teacher, the administrator, and other professionals on the team. If the team determines that the student does not meet the eligibility requirements, then the education is responsibility of the general educators. The next step is step 5, which is the actual development of the IEP, the Individualized Education Program. And this includes, for infants and toddlers, the name of this program is the Individualized Family Service Plan. For preschoolers and school-aged children, the plan is an IEP. And for those students who are 16 years of age and older, there's also a transition component of the IEP. The IEP is a written legal document, and because of that, there are certain things that are required by law to be included in this document. And these include your child's present level of academic functioning, the strengths, weaknesses, abilities, and educational needs of your child, the areas of eligibility or the disability that qualifies them for an IEP, annual goals and objectives, program placement, accommodations, and for those students 16 years or older, a transition plan.
The next step in the IEP process is the implementation phase, and this occurs once the IEP has been written and agreed upon by parents and the IEP team. During this phase, the student is to be provided with all special education and related services which are defined within that IEP. All supplementary aids and services modifications are to be provided according to the IEP, which allows the child to work towards achieving the goals that are within the IEP. This is included in the general education classroom as well as all other student school activities. It's required by law that the general education, special education, and service providers have access to this IEP, are informed of their specific responsibilities, and are also informed of accommodations, modifications, and supports which they will be responsible for providing. During the implementation phase of the IEP, it's important for parents to stay involved in this process. Some suggestions to make this transition most successful is to first ensure that all teachers are working with your child do in fact have that copy of the IEP and understand what their responsibilities are with that. This can help make certain that all services and accommodations and modifications are being addressed by each teacher. Secondly, the use of teamwork makes the IEP most successful. It's important that professionals and parents communicate with each other and share best practices when working with that child. By doing this, you can ensure that the strategies used that are most effective are used during instructional time with the child. Also, keeping lines of communication open between home and school. If there are things going on in the home environment which affect the school, it's important to let those issues be known to the school. Also, be cognizant of your child's progress towards their goals. Regular progress reports are required by law to help you monitor as a parent what your child is doing in regards to making the goal of the IEPs. If it does arise that the student for some reason is not making progress towards that goal, a meeting should be called immediately so you can adjust the IEP to make proper accommodations. The next step is the evaluation and review process. It's required by law that you review the child's IEP once a year to review the goals and objectives within the current IEP. When revising the IEP, there are a number of factors which should be addressed, and this includes the child's progress or lack of progress towards the goals in the general curriculum, any information gathered through reevaluation that has occurred during that time, additional information provided by the parents, and any additional information provided by the school, which could include teachers' comments or observations in coursework, and any of the child's anticipated needs. Although, like I mentioned before, that it's required once a year to have the IEP meeting, if the parent or teacher ever requests an IEP meeting, you can do that within that year. It doesn't have to be a calendar year for that meeting. Particularly if there's lack of progress, a meeting can be called, or oppositely, if a child has mastered a goal, a meeting can be called to review those goals and to create new ones. Also, you need to make sure that parents are advised of upcoming meetings so they can make arrangements, and if there are language barriers, that interpreters are present during the meetings for full understanding.
All right, and last, most of the time, people on the team all agree with the IEP process. If a parent disagrees, they have the option to decide to request a due process to help resolve this matter. We hope that this helped you understand the IEP process a little bit better. If you have further questions, you may ask your school personnel, your teacher, or go to the Ohio Department of Education website for further details. Thanks.